Every Monday this month, we will be having important conversations around mental health. Because in case you don't know, May is Mental Health Awareness Month. Just this morning, the Child Mind Institute is launching its Dare to Share campaign to encourage kids to talk about the issue. It features celebrities, artists, athletes, and role models who are all sharing their personal stories to destigmatize the debate. Take a look.
I myself struggle with depression. It's something that I have to deal with every day. I've taken a lot of steps to try and better my situation. I'm on medication for it. And I just want you to know that there is help and there are resources out there for you.
I think ultimately just telling someone about it made me feel better. And I didn't even need any big pearls of wisdom. Just being able to express myself helped get the overwhelming feelings out, and they stopped being quite so overwhelming.
I will tell you from being a very, very afraid 7, 8, 13, 23, 31, and now 42-year-old woman, it does get better, and there are beautiful moments waiting for you.
Beautiful words. Jamie Howard is a senior clinical psychologist from the Child Mind Institute. She joins us now and will be with us nearly every Monday this month. Jamie, good morning.
Good morning. Thanks for having me.
Of course. Thank you for joining us. Why is it important for celebrities and individuals of influence to share their stories?
It's so important because 1 in 5 children and adolescents has a diagnosable mental health or learning disorder. So these are actually the most common disorders of childhood. But stigma is a huge barrier to care. So when we have celebrities who we look up to and we admire and we know that they're so successful and talented, that makes it seem like, oh, it would be okay if I shared too. I can get the help that I need.
And when you say 1 in 5 children, do you have a specific age range that you think, parents, you really need to pay attention to this particular age, this particular phase, this particular sex?
Yeah, that's a good question. So we like to look at through age 24 or so, because that's when the brain really kind of solidifies and our frontal lobes stop developing and we're adults at age 24. And we know that the onset of mental health problems, 50% of disorder starts before the age of 14.
Before 14?
And
wow.
75% before the age of 24. So that's really what we want to look at, is that sort of childhood through early adulthood.
But what's happening before age 14 that would cause you mental anguish and stress?
I think it's a complicated answer, and it's something we call a stress diathesis model, which basically means we have a biological predisposition and we have the environment we grow up in. And if we're sort of born prone to a mental health disorder, it's going to come out earlier rather than later in life.
So everybody wants to raise resilient kids, right? It's a goal as a parent. You don't want to coddle your kids.
Exactly.
But it's hard to know where the line is between telling a kid to shake it off and get back in there and it being a chronic problem, a real problem.
Right. So you want to monitor. It's okay for kids to have setbacks, and we want kids to have moments of failure. That builds character, it builds resilience. So we don't want to spare children from any disappointments necessarily, but we want to monitor to make sure that they're functioning, right? So if it goes on for, say, 2 weeks of a child being consistently sad and down and not interested in things they used to enjoy, then we might think, oh, this is starting to seem like a depressive episode and not just a momentary setback.
Something I had to learn as a parent was each kid receives information differently. So I have to parent them differently. I can't have the same mental health conversation with my 18-year-old as I do with my 16-year-old, as I do with my daughter who's 12. What advice do you give to parents that might be dealing with different personalities and struggling with an approach to talking to multiple kids?
Yeah, well, so some rules of thumb are that you want to ask open-ended questions and you want to be curious. You don't necessarily want to go in expecting you already know the answer. Kids will always surprise you. So sort of state your observations and with empathy and earnestness ask, like, so tell me what's going on. I've noticed you haven't been spending time with your friends lately, or I've noticed your grades seem to be slipping. And don't jump to sort of reprimanding them, but say, what's going on?
Yeah. What's going on is such a nice way to say it. What about kids who are struggling and don't know how to ask for help? Or parents who are struggling and don't know how to ask for help with their children.
Right. Well, that's why it's so important to have these ongoing conversations, so that the onus isn't necessarily on kids to say, hey, I think I might be struggling with a mental health problem. They don't necessarily have that language, especially when they're young. But if you have repeated conversations with children starting when they're younger, then there's an opportunity.
So suicide is obviously a worst case scenario, but it is a leading cause of death for kids 15 to 19. And we've heard from other guests that you should say the word. It's okay
Yes.
to say to a younger person.
You're not
"Are
planting
you-"
a seed. if
Yeah,
you say
you're
it.
not planting a seed.
Yeah.
Yeah.
Not.
Is that the right advice?
That's true, right? So if someone is not suicidal and you say to them, "Hey, have you been thinking about killing yourself?" They will not think, "Oh, no, I wasn't, but now I am." That's not how that works. It's only if you have a mental health condition that you would say, "Actually, yes, and thank you for asking."
So parents should be frank about it.
They should be frank. There's nothing to be
And
afraid
do you
of.
think children would answer that question honestly?
I think a lot of children would, because it feels really bad to have depression or anxiety, right? Like we want to feel better when we have these conditions. It's often we just don't know how.
And it's not a secret anymore, and that's part of breaking the stigma, actually.
Exactly.
Jamie Howard, thank you very much. We'll see you again real soon. We'll be right back.